This is the transverse section of the thyroid gland of a 36 years old young man, and by placing the probe transversely extended neck, you can see that I am getting this is the left lobe of the thyroid, this area, left lobe of the thyroid gland, and in the right lobe you will see a thin walled cyst with internal echoes, few internal echoes, not too much. Why it is a cyst? See the degree of brightness behind its posterior wall. And so the posterior wall acoustic enhancement is seen, and this is the landmark for the thyroid. This is the common carotid artery. This is the common carotid artery. This one is the common carotid artery in transverse section. Common carotid artery is taken as a landmark for the identification of the thyroid gland in transverse section and then in longitudinal section. Now the cyst at the medial end of the right lobe of the thyroid gland measures 28 millimeters by 28 millimeters. This is air, tracheal, these are tracheal air shadows. And this is a cyst at the medial end. This is a cyst at the medial end, medial region of the right lobe of the thyroid gland with posterior wall acoustic enhancement and a few tiny small echogenic areas within it. And this is the transverse section of the left lobe. This is the transverse of the thyroid gland. Okay. Now, in fact, this area, this small hypoechoic area is in fact the parathyroid gland. At the posterior medial end of the right lobe of the thyroid gland. This is not the common carotid artery, and this is the parathyroid gland that I initially said that this is the common carotid artery, because the common carotid artery will be at the lateral, and it is now this area, this hypoechoic area, well demarcated with no posterior wall acoustic enhancement, is seen at the medial end. This is the parathyroid gland. You see that there are more echoes seen in this region. These fine, tiny echoes. Here the echoes are more. Now let's move on with the further study. Let's see the left thyroid gland in longitudinal section first. Now this is the left thyroid lobe, sorry, right thyroid lobe. Now this is the left thyroid lobe, and here again you see this hypoechoic area within the upper medial end of the left thyroid lobe is the parathyroid gland. This is the second one. This is also the parathyroid gland. And here you see one. There are 4 parathyroid glands, as we know. So this right lobe of the left lobe of the liver in longitudinal section is normal. This is the common carotid artery, which is normal in caliber, and we are seeing the common carotid artery in longitudinal section. This is the parathyroid gland. They usually measure less than 5 millimeters. Yeah, 4.8 millimeters is the size, and this is the longitudinal section of the left thyroid lobe. Its dimensions are normal. It measures 4.0 into 2.2 centimeters. Now let's move on with the right lobe of the liver. Left lobe is unremarkable. We don't see any significant finding in that. No calcification seen. Size is normal. Parathyroid glands are seen. No focal EMS, cystic or solid. Now we go towards the right lobe of the thyroid, where we see cystic area at its upper medial end. In fact, this is the common carotid artery in longitudinal section. This is the cyst, and this is the thyroid tissue of the patient. This is the right thyroid lobe in longitudinal section. The dimension of the right lobe, the echogenicity is low-level force, that of the parenchyma of the thyroid that is seen and is normal. This is the cystic area that we were seeing, a bit distorted in this view, and because this view I took to show you the parenchyma of the remaining thyroid parenchyma, or the parenchyma that is spared by the cyst, has normal echogenicity and the size appears normal. This is the common carotid artery in longitudinal section. This is the cystic area. Okay. You see that this thyroid is normal. Rest of the thyroid tissue is normal. Here I am getting almost all of the thyroid lobe in total, with the cyst at the upper medial end. Now this is a cystic area at the upper medial end of the right lobe, and you can see that there are marginal, tiny, small and dependent region echogenicities within this cyst, and this area is representative of measuring 4 by almost 20 millimeters, is that of the right thyroid, right lobe. This is the right lobe of the thyroid. The echogenicity of the parenchyma of the thyroid that is spared is normal. There is no calcification, no focal vein seen in the rest of the right thyroid gland. This is the parathyroid gland. This is the common carotid artery in transverse section. And so now I am going to go for the, if I scan in this position, in this way, I see the to thyroid. Now this is the common carotid artery in this case. This is the common carotid artery. This is the parathyroid gland, and this is the cyst, and this is the common carotid artery. Here we are seeing two common carotid arteries. This is the left one, this is the right one. This is in transverse section. This is also in transverse section, and see the little posterior wall enhancement behind the cystic area. This is the transverse section, and this area is the isthmus of the thyroid. This is the isthmus of the thyroid, which is normal. See this view. You can see the pulsations within this artery. These are the landmarks for the identification of the thyroid gland. These are the common carotid arteries. Now let's see the cyst only. Let's focus on the cystic area. I am going to give the probe this 90-degree sweep to see if it changes its shape or it retains its shape. Here I am, 90 degrees, I am rotating the probe, still rotating. Now I have given 180-degree sweep to the probe, and you can see that this cystic area did not change its shape. It remained the same in shape and size. You can see the degree of posterior wall acoustic enhancement posterior to this cystic area. So this is the case of right thyroid lobe cyst. Thank you.